It is certainly my pleasure to introduce my mentor, who's going to give our next lecture, Dr. Walt Taylor. Dr. Taylor did his sports medicine fellowship at Cleveland Clinic. I won't say what year. And we were able to bring him down to Mayo Clinic, Florida, to work in our family medicine department, where he eventually became our program director in family medicine and also the director of our sports medicine fellowship. And he served in that role for over 14 years. So he's unfortunately just retired last year, so we had to pull him out of retirement to come join us. So he is emeritus staff at Mayo Clinic. He also serves with the Women's Tennis Association Tour, the WTA, and still has that role at this point. So we are very pleased and honored to have Dr. Taylor with us. He will also be doing one of our workshops this afternoon on upper extremity. So again, if someone's interested in doing that, another shameless plug for those that are interested in honing their skills in upper extremity. So without further ado, Dr. Walt Taylor.
Thank you very much. It is nice to be back with this group, but retirement is going well. So for those of you who haven't retired yet, you'll get there. It'll be great. So the only conflict I have is I do serve as the medical advisor for the WTA. I don't think that's going to conflict with any of the things I have to say today. I will be giving a tennis talk tomorrow, and we'll be doing more on the lateral epicondyle tomorrow as far as the other treatments. So Thomas was great to go through the rehab aspect of that. So what we'll do is start with a little bit of the anatomy. And you see these lines here that are drawn. And so when you think of the wrist, think of sort of two rows of the carpal bones, right? So you have your more proximal row, and this is your scaphoid here with the S, your lunate in the center that kind of centers the wrist. Your triquetrum here along with the pisiform. So the pisiform's on the volar side of the wrist, right? So that if you palpate with your thumb on the palmar or volar side of the ulnar aspect of the wrist, you're feeling your pisiform, and your triquetrum is sitting kind of right on top of that. You also see some space between these bones that are the joints. And so there are ligaments connecting all of these, and there's all kinds of tiny little ligaments in the wrist. But one of the major ones here, we're not going to talk too much about it, but it's part of our differential diagnosis for pain on this side, is the scapholunate ligament, and over here is the